All right, we'll go ahead and get started. Thank you all for being here for our COVID-19 vaccine media availability. On the docket today will be James English from the Health District representing COVID-19 operations in Washoe County. I believe we'll have Melody Osborne from Renown on for Q&A, but she won't have an update, and she just joined us there. So we'll go ahead and get right to it. James, if you're ready to go, please go ahead.
Good morning, everyone. This is James English, Regional Operations Chief for Washoe County's IMT for COVID response and vaccine deployment. Today, we did receive last week's Pfizer shipment that should have been here last Tuesday. That did come in. Because of that, we have increased our pod sizes for this weekend to try to get more people vaccinated. Furthermore, as our partners received their vaccine, we're working on some redistribution of vaccine as we had transferred out over 1,290 doses last week to keep all the other pods up and operational. So that was a big success for the region, that we did not have to delay or reschedule large numbers of pods. But with that, indeed, we do now need to get the vaccine back to where it needs to go, as everyone else is receiving last week's order today. Tomorrow, we should receive our Pfizer order. We don't expect any delays in that. The reason we were able to stay operational last week was we did get our Pfizer vaccine on the holiday. Currently, we are working through all of community frontline support. We have that completely wide open for anyone in those essential workforces. And then we are also going to concentrate really hard the remainder of this week to reach out to the rest of the 70-plus community in Washoe County. So that list looks to be down to around 10 to 11,000 names. Of course, there's still a lot of duplicates on that. But with the vaccine we got that should have been here last week and the vaccine we ordered for this week, we are ramping up our operations over the next week, and we should be able to accommodate both those lanes at this current time. And that'll give us the due diligence to then move down into the next essential workforce group late into next week. With that, that's the end of my report for today, and I'll open it up to questions.
Thanks, James. Appreciate that. As he mentioned, reaching out to the senior population is absolutely critical. And we just continue to ask for people's help in terms of if you have a neighbor, a friend, or a family member who is senior, to help them navigate just kind of the email process. How it works is they'll get an email with a link to sign up, and you need to click the link to sign up and put in some basic information to get your appointment. We know that about over 75-80% are receiving the email based on the analytics we're getting from our software, our distribution software, which is a good amount in terms of email marketing. So we know that they're getting the emails. It's just we need them to make sure they follow instructions on it so they can get themselves set up. With that, we will open it up for Q&A for James English and Melody Osborne from Renown. So if you have any questions, please feel free to reach out right now.
James, this is Paul Nelson with 2 News. Knowing that you guys are getting down to that last 10 or 11,000 with the 70 and up, what does that mean for the 65 and up group? When will that maybe start?
So actually right now in Washoe County, many of our other partners are at the 65 and above age group. We are trying to do the best due diligence possible. We're still waiting for some demographic information to the state to ensure that we have properly reached out to the 70-plus population. We are hearing from our partners that they are having trouble scheduling 70-plus. We continue to hear here at our call center that there is a need for 70-plus. So although we haven't officially here at the Health District moved down to 65 and older, we do have that list, but most all of our partners that have requested to drop down to 65 plus have gotten that approval from us on an operational standpoint, so long as they have produced a plan on how they're going to schedule and be open to the general public for that age group.
And you mentioned the shipment getting the Pfizer shipment from last week today. What does that mean for this week? Are you guys going to be basically working double time, or does it affect your operations that much?
Actually, the Pfizer shipment we're getting this week is this week's order. What we've done is we've really just increased our pod sizes on Saturday to accomplish more vaccinations. And then we have slightly increased some of the others. We will be able to add some add-ons, but we have also really increased our operations on Monday and Tuesday of next week. So since shipments could come either Monday, Tuesday, or Wednesday, we need to make sure that when we receive the shipment we got this week, that we can actually operate through Tuesday. And we continue to do that. So we have actually really increased our operations for March 1st and March 2nd. We're going to run 2,100 first doses on both of those days. We're typically, during the weekdays, we're only running about half that, or 1,050 first doses.
Is that because you're receiving more doses per week now? How is that looking?
Well, it's actually because we received last week's Moderna this week, and we originally had intended to have a large-scale pod last week that we ended up postponing, and then we shortened to later on in the week and switched them to Pfizer. An additional item I'll bring up is we're having some issues with the general public showing up to both our testing site and our vaccination site refusing to wear masks. It's really critical that everyone continue to wear masks when they're in their vehicles and the windows rolled down and interacting with our staff. We cannot afford to have our staff exposed to COVID. They are essential and need to make sure we can continue running our vaccination site. So we had some issues over the weekend with people refusing to wear masks, and we will, going forward, politely ask individuals to leave the site until such time that they put a mask on. We will have masks available for any citizens that happen to forget theirs. Most everyone has been great about that. This is the first time we've really had some issues, so I wanted to stress that today.
Hey, this is Bert Johnson with Nevada Public Radio. Thanks so much for giving us the opportunity to ask questions. Just to follow up on what you just said, can you give us a little more info? Were the people refusing to wear masks in line to be vaccinated? And was this an ideological stance, or was it some kind of medical misunderstanding where they thought maybe, I'm about to get vaccinated, so I should be good to go? Can you give us any more info about what that situation was?
I can't give you any more info on what the rationale was for why they didn't want to wear masks, but they were refusing to. And as you'll see at our pod, we're not in the level of PPE we were all summer or all spring. So we have downgraded greatly based on the information known about the COVID virus and the spread, and also to make it more comfortable for our staff. So many of them are just wearing regular masks and not N95s any longer. Some are wearing face shields, but I can't speak to why these individuals were refusing to wear masks. But it was brought to my attention this morning. It is a safety issue. Many of our staff are flown in from all over the United States, and we're requiring them to be tested on a weekly basis as they came in and continue to be tested, and we just need to make sure that everyone's as safe as possible out there.
Thank you. And one more question. You mentioned that you're still waiting on some demographic data for the state. Just to be clear, that's demographic data related to vaccine distribution. Is that right?
It's actually demographic data related to the ages of the individuals being vaccinated and the workforces. But right now, we're really trying to get the age is that we have vaccinated, because we know we have approximately 51,000 plus seniors, 75 and older, and about 27,500 between 65 and 69. So we want to make sure that most at-risk group of 70 plus has had the opportunity to be vaccinated before our large-scale pod goes down to the 65 plus. Furthermore, unlike Southern Nevada, the Washington County Health District really is only controlling probably around 60% of the vaccine. So we can look at our analysis of the data, but we can't see what other providers have done. We have to rely on the state for that information.
Thank you.
So today, Sparks Fire Department started vaccinating people 70 and older. How nice is it just to see more partners stepping up? And even though it's only 100 people per day they're doing, that it's an increase at least, right?
Yes, exactly. We work very closely with Sparks Fire. That is a tremendous relief. Anyone that can continue to run any level of a pod of any size, we greatly appreciate. They have gone above and beyond. They figured out a way to do the scheduling. They've opened it up. They're accepting the phone calls. We have also provided them some individuals in their areas and zip codes that they can also reach out to. I think over the next couple of weeks, you're going to see some other pods set up that will be run through the federal partnership and the pharmacies, but we are also working closely with some larger medical providers that should be able to start having some pods over the next couple of weeks. 2 or 3 of them had planned on doing pods last weekend that had to be canceled when the Moderna vaccine did not show up. So now we'll go back and work with them on the planning, but those will be open to the general public and just not their patients.
Looking at the state's data from yesterday, they show that Washoe County there's more than 66,000 residents that have gotten at least one vaccine, and then 36,000 have gotten both of them. Are you pleased with how that's going?
Well, of course, we'd always like it to be going better, but what we're really pleased with here is the large percentage of our individuals that have received their second shot. So they have the largest protection going, and we have looked at some of the data around the state and have heard we have some of the highest percentages per capita of first and second doses in arms. We did complete a closed school district pod on Saturday where we got another 650 plus educators receive their second doses, which was a great win for the community.
Jim, this is Bob Conrad with This is Reno. What is next? What's after the 70 plus and then the 60-year-old demographics? What are you doing after that?
So after that, if you look at the state playbook, we go into frontline supply chain and logistics. So we'll be working on the agriculture and food processing. And then we'll also be working on all the end-to-end and essential goods supply chain, which will include the manufacturing, the transportation, distribution, and essential workers there. So that'll be a large group for this community. You're going to have a lot of warehouse workers. You're going to have your grocery store workers. You're going to have a lot of the people providing services to this community. Your transportation will start seeing additional vaccinations. You'll have your delivery drivers that are showing up to your house start receiving the vaccination. So it will be a very large group for this community. The agriculture and food processing will go very fast. Obviously, we don't have a large farming community, but we do have some large food processors and manufacturers here. So they will go ahead and get the vaccines first so that they definitely can be at work and continue manufacturing and packaging the food for this area and also for a large portion of the Western United States. Reno and Northern Nevada seem to be a large distribution location for the Western United States and California. So we need to make sure that all those essential workers can continue to show up to work safe and well.
Thank you.
I have a question for Renown. How are things looking as far as you guys are with your pods? Are you starting to see your demand start to thin out a little bit, and now you're thinking about moving to 65 and up too, or are you guys already doing 65 and up?
Good morning. Thanks for the question. So scheduled for this week, we are planning some additional days for our dose 2 patients. We are planning to open up to 65 and older beginning next week, but that is dependent on the vaccine shipment. So right now we're scheduled for all of our dose 2s for this week and planning to open that up to 65 and older next week. But we have not seen a decline in our visit rates. I think there's still a tremendous demand for this vaccine.
Are you guys still doing about 1,000 per week?
We're actually doing about 1,000 per day when we have our clinics up and running, and things have been running smoothly.
Any other questions for James English or Melody Osborne? All right, hearing none. Thank you all for joining us today. We'll be back again on Wednesday with Kevin Dick, District Health Officer. And just a reminder, keep an eye on your invitations for the Monday and Thursday media availabilities. Depending on scheduling conflicts, if there is a cancellation, it will we'll update the meeting invite, so you should get some sort of notice that it'll be canceled or postponed. But if you have any other further questions for me, feel free to send me an email or give me a call. Otherwise, this recording will be on our COVID-19 Washoe website here pretty soon. Thanks again.
Thanks, Scott.